Thank you. Good morning. How's my voice and my volume? Hope everyone can hear me. My name is Javelin Hardy. I'm currently in Louisiana. I retired last December of 35 years as a social worker. I was in the field of human services, used to work with aging and disability services. Then I was a parole officer for 10 years, got in the medical field, the education field, and now I get to do what I want to do. I'm currently a holistic practitioner and a yoga instructor. I got into body work because I realized doing counseling sessions, I was educating a lot of clients on what their symptoms, diagnoses is, making sure they're taking their medication, but at the same time, they were still experiencing various things with their body. So today, I hope that everyone will participate as voluntarily, but at the same time, take something away from this, especially with the climate that we're in now. A lot of unexpected, not knowing things that are going on in the world that will affect you as a practitioner and will affect your clients as well. I also will be doing trauma disclosures for some of the case studies and vignettes. You can participate if you know at any time something has caused a trigger or either an upset. Please give yourself permission to step away and then come back to the presentation. If you're walking around with your phone, we can see you. It makes me dizzy. So if you can either turn the camera off when you're walking around or either get settled, that'd be great. So this is our goals and objectives today: to understand how current events keep us in a heightened sensitivity to stimuli or emotions that's not only prevalent, but also amplified and normalized. It's almost if society these days, especially when it's around politics, because that's what we're going to be talking about also in this presentation. New words, new readings. When I was doing research, I've never heard of political trauma. But now that we are in the climate that we're in today, I right now believe there is a such thing as political trauma. Understanding how hyper sensational creates a society where even the most sensitive individuals are experiencing high sensitivity and reactivity. So we also are going to be talking about what you're seeing right now as practitioners, what you're seeing with your clients. How can we create a balance between sensitivity and resilience, creating a culture of empathy and understanding and reasoning? Practitioners will learn what is trauma, and I'm sure some of you are already familiar what trauma is. I know back in the day, we actually look more as to, first line responders, police, firefighters, military, people that work in hospital settings. But now, due to the climate that we're in, we're also seeing a variety of different types of trauma and PTSD. And we want to see if it has anything to do also related to different symptoms that you're seeing. Practitioners will learn the following terms: hyper-sensational, hyper-sensational, sensory overload, emotional reactivity. And once again, I would say a disclosure when I get ready to share the vignette. So we already said who's here. I didn't get a chance to see some of the folks in the chat. Please put where you are from and services you provide. If a couple of people want to share right now, you can raise your hand. And because just like I said, I do want this to be interactive. So what's new in the behavior health field? How are these changes affecting you, your clients, and the world? So let's just start off with that question. What is new? What are you seeing? Because I know a lot of us are here from different states here. So get a couple of people, about 3 or 4 people, if you don't mind coming off camera and sharing. What are you seeing? Anyone? I don't want to be the only one talking. Anybody going to be bold enough to come on? So let me look at the chat. I don't want us to do crickets here. Private practice, Boise, a lot of dysregulation and fear. Okay. Oh, that's people still doing their introductions. So what are you seeing? I saw one person put a lot of dysregulation and fear. Anybody else? Uncertainty. That's true. Burnout.
I've been seeing a lot of political, fear and, potentially triggering trauma in individuals.
Okay. And who are you and where are you from?
Yeah, my name is JC. I am from Cottonwood, Idaho, so very rural.
Thank
Um,
you. Thank you for
yeah,
being bold to come on. I hope
yes.
other people will be coming on too. Thank you.
Thank you.
Somebody, I'm from Treasure Valley. I don't know where that's from. Area, just graduated with my master's of clinical mental health counseling. I'm not sure what exactly is new since I'm merging in the field. And at the same time, much of what I do in my actual work with clients is not exactly different from what I was taught, but it's certainly amplified in compounded environment. So when I ask that question as well, I'm also talking about insurance. I'm also talking about as far as what you used to be able to do, especially if you're a nonprofit. I'm talking about federal funding. Is your funds on hold? I know some programs right now that I used to work for in Oregon, right now their funds are on hold. Difficult maintaining services, providers to do challenging work, uncertainty again, sexual abuse trauma, isolation, all the different gender identities, and I'm going to be talking about that too. Anybody else?
Sure, I'll share.
Thank you. Go ahead. I appreciate you.
Sure. My name's Erica and I'm located in Boise. But I do navigation work throughout the country. And what I'm seeing here is a lot of confusion um, and concern about Medicaid, how it's going to impact Medicaid and Medicare benefits,
Thank you.
especially among people who voted a certain way.
Mhm.
And in other parts of the country, a lot of people who are LGBTQI, two S plus, are
Mhm.
really worried about their safety. Um, yeah, a lot of people very concerned about safety, about benefits, and I mean, I'm concerned about my income as well, and I'm concerned about my health insurance. So, because I get it from the marketplace. So there's quite a lot of fear.
Thank you. Thank you. Thank you for being vulnerable and thank you for being real because that's what I'm hoping the conversation will be about. It's just not about me presenting because keep in mind, even though we're in the positions that we're in, does not mean that it does not affect us. You know, we are here providing a service to our clients and we take in a lot. And sometimes you could be overloaded. And if you're very sensitive to things and you're experiencing similar what ifs, fears of not being able to know if you're going to be having that financial support or gain or either with your clients with the Medicaid and Medicare. So what is trauma? Trauma-informed Oregon described trauma as a wound. And I like this definition. I've seen various definitions over the years, but I like this one. Typically refers to either a physical injury, such as a broken bone, or an emotional state of profound and prolonged distress in response to an overwhelming, terrifying, or unstable experience. Some trauma, like wounds, heal relatively quickly. Some heal slowly, and many influence life going forward, like scars. Scars and trauma do not result in effects or deficiencies, Rather, they are markers of life experiences one has survived. And every time I read this, it reminds me of the book, The Body Keeps the Score. Because keep in mind, what we experience, our body keeps a record of. It's like a panoramic, a video recorder. Your five senses is reacting to memories and triggers of any event. Trauma is all,
Javelin,
yes.
you might want to share your slides again.
Oh, you don't see them?
No, we know you can see them.
Oh,
I'm seeing the slides. Oh, not anymore.
oh, okay,
Okay, good.
okay. Is everybody seeing them? Oh, okay,
We were, but not anymore. Okay.
okay,
Now we
okay.
do.
Don't scare me
There we
like
go.
that. Don't scare me, Mary.
Well, now I see them. I didn't see them before.
We are directly experiencing and witnessing events that threaten and violate our safety, health, and life choices. And that's something that I really want to stress right here. Keep in mind, it says we. That includes us, not just our clients, but we as well. So people that are in the health field, hopefully that you can chime in. And I'm speaking more so of people that are working in hospital settings, clinics, or either you have collaborated with like an IOP. I used to work in an intensive outpatient program at Providence Hospital in Portland. So health-wise, what are you seeing? What has changed? Healthcare providers. Come on, you guys, let's participate. I know it's early. Get your coffee, get yourself going. What are you seeing?
One thing that I've noticed too is that the geriatric population has a really hard time navigating the healthcare system and, advocating for themselves. And yeah, I've just seen that as a barrier in healthcare.
Thank you.
Also, the behavioral health aspect of that is that they're, that population, or that generation grew up differently, obviously. And so their take on mental health is different. And so getting them services in mental health is sometimes difficult.
Okay. So thank you so much, JC. I'm getting ready to bring up a sensitive topic. So here is a trauma disclosure. I am in a southern state, okay? A lot of southern states have an abortion ban, okay? Right now, there's a case in the state of Georgia where there is a mother who is unalive, but they have the mother on a machine because she's currently pregnant. The family does not have any power or rights to have the mother taken off of the machine. Comments? What did you just hear and what did you just feel from what I just shared? Anybody else keeping up with that case? I'm following that case right now. And I mentioned a lot of words, especially power.
Yeah, I had put in the chat too already about and what you're talking about just tied
Okay.
in. There's just a lot of like, I don't know if you're aware of the politics of Idaho, but they're not unlike the of your state. Although we never got Stacey Abrams, that's okay. So, but anyway, yeah, but folks are feeling a lot less hopeful, lots of confusion and concern about the future. And I have been following that case that you're talking about, that situation that you're talking about. And I think that really ties into just like, how did we get here? What is going on? How do we get out of this? Are there any adults are doing anything about this? I think that's kind of a place where I think I keep waiting for like an adult to show up and like do something about this, and just have this real memory of like just having this realization of like nobody's like we are the people we're looking for. Like there's not like a magic, there's not going to be a magic being to come out of the sky and handle things for us. And but I think that's with our clients right now too. I've just people that I work with of just like this kind of future, like how did we do this? But yeah, but I think that just really ties into that situation you're talking about in Georgia about just because that's one of those situations where it's just like how there's a lot of questions there and not a lot of answers, I think, at the end of the day.
Thank you so much for being vulnerable and participating, because keep in mind that family still needs support. You know, and I know I saw in the chat a couple of people say, I try to stay away from the news and politics and everything. I do too. But at the same time, when a client comes in and talk to me about something, they either just gave me some new information that I was not aware of, and then I feel as if I still, on an ethical level, need to be aware of certain things. Because keep in mind, yes, it does affect us. I agree. But at the same time, do I need to know? Yes, I do. Okay. So I asked this question earlier, and I'm going to go a little bit more and deeper into it. And you tell me statewide, especially if you're in a different state, what current changes with healthcare insurance can affect you and your clients' access to care? I take a lot of Medicaid clients because I also contract. Here it is. I said I'm retired, but I'm semi-retired. And I contract with a lot of, I contract with clients who are on Medicaid with the state of Louisiana. And we see families, we see from children, you know, to adults to seniors. And we also are told how many hours or units we're able to bill. If you're able to not bill so many hours at this time, or either something has changed with the care, because I'm still familiar also with Care Oregon, Medicaid in the state of Oregon as well. And one thing that I know I saw first, because this is big, where when I was living in Portland, Oregon, was working with the LGBTQ plus community. And a lot of them have lost benefits when it's time to be able to discuss with somebody if they want to have a transition, or the medication is not being covered. Have any of your clients in this community lost their benefits?
Hi, so I'm a contractor on a military base, and we actually are going through all of this because we're impacted. And so I see clients for different reasons, and there have been some members that have lost. They're being med separated because of their identity and because of how they identify. So they've lost services, or they're like not able to do their job anymore. So we see that consistently here on base because we
Wow.
have quite a population, unfortunately. And so they're doing the best that they can. But I had a member recently, and I had to transition them to our mental health clinic. But they are losing their jobs ultimately, and their retirement benefits and all of that because of their identity.
Oh, wow. Thank you. Thank you so much. So JC says, in Idaho, things are always changing, with LMSW seeing certain insurance even when being supervised and billed through a supervisor. This limits access to care. And then when that limits access to care, if you are kind of, you know, used to applying for different programs, and those programs are being held up right now, that limits also access to care. So I gave two handouts. I gave a handout on what is trauma and common reactions to trauma. And then I think the third one was triggers. But right now, what I want to encourage everyone to focus on is the trauma risk factors and the symptoms of trauma. So keep in mind, acute events are chronic traumatic situations. Single events accompanied by intense fear or helplessness. You guys just stated all those words in the chat. So trauma, it says, a powerful emotional response to a distressing event, such as war, an accident, the unexpected loss of a loved one, or abuse. But listen to the trauma risk factors. And if you have a piece of paper or something to write with, just put a check mark on what I'm going to read read versus what your clients are experiencing. Or if you want to be vulnerable and state, this is something that I'm experiencing, listening, you know, especially that countertransference, because countertransference is real. The traumatic experience was unexpected. The victim has experienced past traumas. The experience happened repeatedly or over a prolonged period of time. The trauma occurred during childhood. Feeling of helplessness during the experience. The victim is dealing with the major stressors related to the trauma. And since we were going to be talking a lot today about the body, avoidance of traumas, flashbacks, and this is the two that I really want to focus on. Startle response and distressing dreams and other sleep problems. I had a young man that I used to work with when I was at Portland Community College, and he was an ex-gang member. And he shared a lot, and I'm going into some of the common reactions. He shared a lot with his dreams. He told me he was always running. He would wake up totally wet from sweating. He was always running. He was always ducking and diving. He was always either in a car or running. So when he's outside of the car running, he's always looking for cover. He's always saying that there's either bullets flying or somebody getting hurt. But the main thing that he said that bothered him the most was when he was driving in the car and if he had one hand on the steering wheel and shooting with the other. Unfortunately, with his flashbacks and distressing dreams, it interfered with his personal relationship because he was acting out a lot of the behaviors in the bed and unfortunately hit his partner. So are you seeing and hearing any of your clients acting more out of their dreams to any type of trauma? And if so, what are they sharing? Anyone? What are your clients sharing? Nobody's going to share today. All right, we're going to keep it going. And I don't mind if it's the same people, but what my goal today, you all, is just not to read the slides and for me to be the only one talking, but keep in mind what climate we're in right now. So we all need all the support that we can get from one another, shared experience, understanding what needs to be changed, understanding what skills I may need to increase or either get support with. So let me go to the chat here. Feeling helpless, overwhelmed, insomnia, not necessarily acting out, but during dreams, but increasing how the trauma symptoms affect daily functioning. Okay, thank you. All right, so let's go to our first vignette. Okay, and trauma disclosure. This isn't a deep detail one. I do have one that's a little bit more intense. And if I could have 2 to 3 people volunteer, I'm gonna kind of press a little bit more here today and hopefully folks will volunteer so you can truly get something out of this presentation. A veteran comes into the office stating that he recently lost his job with the federal government. At this time, the veteran is receiving VA benefits. The loss of his position has put significant stress on his family. The veteran appears overwhelmed, depressed, and states his family will be better off if he takes his life. The family will have full benefits, medical and financial. What will be the first thing you will discuss with the veteran? And there's no wrong answer here. If you have never worked with veterans, what would be an ethical decision you should make?
I would say to start with, I just need to assess if there is any, like, what is the level of risk. And then after that, then yeah, like how we can help him. But first is after he disclosed that his family will be better off dead, that he will be, family will be better off if he was dead. Yeah, she says it's for risk first, first thing, and then after that, then
Thank you, Rosa. Alexis says, what part of him feels that way versus other parts that may feel differently? Maria states, level of suicide risk, safety planning, access to lethal means. Start with compassion and then safety assessment. And then remind him that he has more value in his family's life than just money. So start with compassion. Starting with compassion looks like what? What kind of statement? Starting with compassion.
I could answer that.
Thank you. Thank you so much.
Yeah, just reflecting to him what he's feeling. So
Mhm.
making sure he knows that I understand that he is depressed, he's feeling hopeless. Like if I can establish that rapport and make sure that I'm not immediately starting to say, okay, tell me about your plan to kill yourself. Like we're starting with, let me just show you that I understand who you are and where you're coming from. And then, I can build that safety planning in, but just meeting him where he's at.
Yeah, yeah. And not only that, just the conversation of like, who does your family consist of? Because I'm very personal, and I'm the type of person, especially being from the South, just asking, who is your family? Is it just you? And if they say, hey, it's my wife and we have 3 little kids, well, what's the age of the kids? They're 8, 6, and 4. Wow, and I see here validating his struggles, validating his pain and fear. That's good. And just being able to ask more probing questions like, so if that decision is made, who will take your place? You said your parents in another state, your mom's sick, your father's elderly, and then you said her parents are not around, right? So, just think about what you have just said. But not only that, let's bring your wife into the picture, kind of doing a little narrative exposure. What would it look like if you were not here and your wife needed that support? What would it look like if your 8, 6, and 4-year-old lost their father and never had him around or never been to their graduation or either walked them down the aisle? Just kind of, what would that look like to even just propose that conversation, because you cannot talk anybody out of something, but you can talk to them about that something that they want to do and creating a future picture of, well, what would it look like? Somebody wrote something along the lines of, I hear how much you care about your family and want to provide for them. Is it so hard to see hope right now? I like that. And then another probing question, for me, if you got laid off and if you have a family, I don't know if anybody hears from the VA, especially when it comes to benefits, will that income increase? Especially if you have a wife and 3 children. And then not only that, what other type of medical benefits? Have you looked into anything before you go to that extreme with taking your life right quick? And when you say they will be better off, how would they be better off? Are you saying financially? And if so, have you even looked into what they may be getting now versus if this happened? Questions, comments? Especially around the probing questions and the conversation and the role playing that I just did. Anyone? Okay, let's keep moving. Did I miss anything in the chat? I'm trying to multitask here. Love the narrative therapy approach. What would this look like? Yeah. Because keep in mind, if I can find out that I will be making about the same amount by adding them, because keep in mind, if you're working for the government and you're a veteran and you're receiving two different incomes right now, and then you lose that one, what would it look like in finding out about the benefits before I go to such a drastic decision? And I think we talked a little bit more so about the reactions and the triggers. So let's go to, if you don't mind, because I did want to look more into the triggers. So the reactions, re-experiencing the trauma, avoidance of trauma, negative thoughts and feelings. How are you and what are you doing with the hyperarousal? It says reactivity or feeling of being on edge. What if your client came in and talked to you more about, being on edge, maybe getting worsened after experience of trauma? This category includes a broad range of physical and psychological symptoms: becoming irritable, quick to anger or aggressive, heightened startle reaction, difficult concentrating, frequently scanning the environment or watching for trauma reminders, feelings of anxiety, related symptoms such as racing heart, upset stomach, or headaches. What goes on in you when you see sirens? What goes on in you when you hear a lot of police or fire trucks? Not leaving the house? That depression voice can be so tricky in telling people they are better off, but it fails to share how loved one completing suicide can increase their risk for suicide. Yeah. How devastating that loss can be in the short and long term wrong run. Thank you, Alexis. Okay. So do I have any clinical supervisors online here? You can raise your hand or say, okay, Sheila, anybody else? That's one person I'm gonna be picking on. And I can't see everybody, so here goes. And if you don't mind, Sheila, I'm gonna have you support me with this and hopefully somebody else can. So this is a trauma disclosure. This is a true story. This is not made up. This is me as a student in the master's program. In 2011, I was a grad student at a university. I was at an outpatient mental health counseling center completing my internship. One of my first clients identifies as a Caucasian male in his late 50s and shared he had millions invested in stock. This was during the 9/11 bombing attack, and he lost everything and decided to unalive himself, but was unsuccessful. He came to his first appointment with a disfigured face from the gunshot wound, and he was not able to control the saliva running from his mouth. He chose not to wear face covering. Keep in mind, I was a new student in an MSW program and new to counseling as a therapist. As a trauma-informed counseling center, what would have been beneficial for me as a new student and intern before assigning me this case and assessment? What biases do you think I struggle with from a cultural and social economic perspective? What policies and protocols do you have at your center office that prepares you or your student counselors before assigning a case to the intern? And I know that was a lot, but I also want to have folks thinking today. So first question. Go ahead, Sheila. I didn't know whose mic that was. I assumed. I'm sorry.
Sorry, that was mine actually. So my
Okay.
first thought was just when as an intern, obviously like taking on a larger or a more complicated client. So my first thought with this client is his what is his level of safety, since he did try to or had a suicide attempt, how much longer, or what, sorry, my words are not wording. What is the time frame from that attempt were you seeing him? And has there been struggles since then with safety?
Okay, thank you. So keep in mind, this is all about the student. As a trauma-informed counseling center would have been beneficial for me as a new student and intern. Before, go ahead.
Hi. I think that maybe it might have been beneficial that you shadowed a clinical provider that has been doing this for a long time to kind of see how you might like respond or learn from that. Because I feel that having you step in that role as a new student or even as a new MSW, you may have just felt lost or unsure of how to address this person because you weren't aware and you didn't have the background like some of the clinicians that have been in this role for a long time. So I feel like
Yes.
maybe more training or even just having you shadow in those sessions or joint working together on it.
Yeah.
I mean, I've supervised interns prior, and so that's things that we've done because I've worked in a community setting prior. And with our interns, we worked with them until they were kind of comfortable and we then let them lead, but we didn't drop them right on their heads in a situation like that, if that makes sense.
Yes, it does. Yes, it does.
So I guess what I was thinking, I've worked in a few different environments, and in my career, and I'm at a university now where I work here at the university, but I teach as an adjunct as well. And something that I really try to like put in the classroom with people that I supervise is around those like the SAMHSA, like trauma informed approaches. I think are just like really foundational and things that we can build into agencies. Like they're not impossible to build into agencies into practice settings. So really like giving new social workers or even somewhat experienced social workers that or professionals in general, I guess, that sense of like psychological safety that they can ask questions, that they're not going to be penalized for, seeming stupid or not knowing or whatever, being trustworthy and transparent. I think sometimes being in agencies, I think we've all, well, I don't want to say all, but I suspect many of us have been in spaces where we just don't trust the leadership. And so it's really hard to like grow and do what you need to do when you like when there's not a sense of trust in the agency that they're going to do what they said they're going to do. That peer support, really building in that space where like peers can ask questions of each other and staff things and do what they need to do. That like collaboration piece, giving people that place to really like have that empowerment, voice and choice where they can speak up. And again, they're not going to get like slapped down or told, well, you should know that, or why don't you know, like whatever. And then also to really having that awareness of those kind of like cultural, like historical issues within an agency of like, this is something I've been like kind of like ruminating on a lot lately. Like I said, I work here at university, and one of my colleagues always talked about this program in another state. It was one of the top academic social work programs in the nation, and they talk about how they're a fantastic social work program that does very good research, but then you go outside of their doors and it's like blight. Like what they're talking about like doesn't translate to like outside of their walls. And so I think that's really important, is like making sure that the communities that we work, that the work that we're doing is actually like a part of the community, not just happening like in a silo. Because we can all think we're like real smart in our offices, but if we're not like attuned to like the cultural factors like of veterans and things that are happening outside of our walls, I think we all suffer at the end of the day. So that's kind of my kind of stance on that. Those trauma-informed approaches through SAMHSA, like they're pretty foundational, and I think building them in is not impossible to do.
Thank you. Thank you. Thank you, everybody, for your input. So first of all, the younger Javelin was scared to death. Okay. I actually froze when I was assigned the case because nobody reviewed it with me first. So my supervisor, and this is after I had heard his story, just, greeting, my name is Javelin Hardy, going over the rights and responsibility consent, so forth, so on. And, just let me know, why you are here. And as soon as he shared his story, I just stared at him. Okay. And I also came to, but it was after a while. 1 to 2 minutes felt like an hour. And this is what I did in a boldness of not hurting anybody, because I am to the T of the motto for a social worker: do no harm. Do your best to not do any more harm. And I said, Mr. So-and-so, do you mind if I go get my supervisor? And he said, no, I do not. So quickly in the hallway, went to the front desk, told them to page my supervisor. It's an emergency. I don't know what she was doing, and I did not care. Okay. First of all, I'm the type of person, whereas to, because they end up doing some various policies and procedures and redoing stuff. So what they did start doing was looking at why the person was coming before they will assign them. That's trauma informed. Should I give Javelin this type of case? No, I wouldn't have assigned Javelin this kind of case at all. I would have started off with things like anxiety and depression, and due to the fact that what he had shared also triggers some of my biases, because you have to be totally honest with yourself when you are hearing what your clients are sharing. And if it's distracting you from hearing, because all I heard was millions. I've never made millions. So then I had to make sure that I was focused on what he was sharing. So my supervisor ended up coming in, supporting me while I was doing the assessment. And after he left, we went on ahead and reviewed it and reassigned him to a more experienced caseworker counselor. So you don't have to answer. But if you're an intern on here, I know I saw somebody in the chat a few minutes ago stated that they just finished their MSW. Are you brave and bold enough, if you were to get signed something that was out of your scope of practice and you haven't learned that depth of knowledge yet? Would you keep the case? Or would you be bold enough to ask for help? Okay, that's just something to think about.
Javelin, there are a couple of comments in the chat, one from Brianna and one from Alexis.
Okay, go ahead. You gonna read it or am I reading it?
I can read it.
Thank you.
Brianna said, working with the student to understand countertransference when working with a client like this, their own responses and ways to manage this internally. Even highly experienced clinicians struggle when working with clients that had a serious suicide attempt. And then Alexis said, talking with your supervisor about what was brought up for you with the referral. For example, what was your gut reaction to hearing about the suicide attempt? What bias is being brought up for you? And what fear or fears are you experiencing? How can you seek out supervision with this case? And then there are some more too, after your question. Jacqueline says, I've spoken up in the past about cases I've had to switch from. And Pamela said, I struggle to ask for help, but when it comes to understanding why someone is doing what they are doing, I ask for help.
Good for you.
And Alexis said, we have to take our own advice and ask for help too, that's for sure. Kelsey, it's important as clinicians to accept challenges and grow our scope of care. We also need to give our clients the best care possible. And if in collaboration with our supervisor, you decide that transferring the client or referring out is the best option, that is extremely important.
Yes, it is. Yeah, because but keep in mind, this sweet soul already been through enough. And I don't want to be in a place where first of all, because I've supervised a couple of MSWs. And the first thing I start talking to them about is, what have you not gotten over? yourself, because it's going to come up when you start seeing people. And I also talk a lot to them about their self-care. Are you seeing someone? And if you are, that's your business, and that's okay. But keep in mind the level of just the level of trauma that that gentleman had experienced. And not only that, what made me go and, have the more of the freeze, if I would say, was the disfigured face that was not covered. I'm a realist, I know what I can deal with and what I can't deal with. Could I work with him today? Yes, I could. All right, so we're gonna move on a little bit. If you need to get some water or a break, we're gonna get ready to chuck on here. So current events, the mental health of political. So let's talking about that word I told you I found out about, that there is a such thing as political trauma. There was a survey done out of 800 Americans found the following statistics, and this is about the impact of politics on your well-being. More than 25% felt depressed when their candidates lost an election. 1 in 5 had lost sleep over politics. 20% reported feeling fatigued because of political news. 29% reporting losing their temper over politics. 1/4 said they felt hateful toward those with their opposing political views. More than 20% reported political disagreement damage to their relationships. About a third respondents reported that political unrest triggered compulsive behaviors. Specifically, they found it difficult to stop consuming political information or stop thinking about politics. So we're going to talk a lot about allostatic overload. That's a word you sometimes you see that medical, you see it in music, but we're getting ready to go into the body. Remember I told you I'm gonna kind of change my point of view as a counselor, with this body. The 4 types of, I saw a comment. Do I need to look at that before I go on? Sorry. I see that comment thing come on and it gets me. So acute allostatic load. This type rises from a single short-term stressor. Its brief, intense reaction to an immediate threat effects on the body. Almost sounds like PTSD, right? Immediate response can spike cortisol levels, increase heart rate, and induce a fight or flight response. Repetitive allostatic load. This type emerges from repeated exposure to similar stresses over short durations. Effects on the body's constantly elevated stress response can begin to wear out the body system, potentially leading to conditions like chronic fatigue. Chronic allostatic load, persistent stress over an extended period leads to this kind of load. Effects on the body. So this is some of the stuff, start looking at your clients and checking in with them. Can compromise the immune function, elevate the risk of chronic disease, and even lead to mental health disorder. Cumulative allostatic load. This encompasses the total wear and tear of the body from all kinds of stress, both intense and prolonged over a lifetime. Effects on the body over lifespan, cognitive function, and well-being. Somebody said, this is why I stopped watching the news. You can still feel it though. You don't just have to not watch the news. Just like I said, I don't know what your clients are sharing with you, but I'm hearing a lot of what I used to have and what I don't have anymore. Ian says, I've had political nightmares because of the decline and being an activist, and I've been losing good sleep because of that. I've met with many clients who have struggled to maintain connections with family members with opposing political views, creating brokenness in the extended family culture. Yes, they weren't sure how to repair. Being a progressive in Idaho is part of that. Thank you. Okay. So I want to do with you guys a mindfulness exercise, especially from what I just saw in the chat. Is it hard for you to be present right now? Okay. Is it hard for you to be in a place when you're having your client share with you what's going on? Is it hard to be still? Is it hard to hear? Is it hard to accept what I can and I cannot do? One of the most powerful things about giving yourself forgiveness when you can't help with everything is realizing how much control we do have. So in saying that, my mantra, I give what I can, and I love with what I give. So I give what I can, and I love with what I give. So show yourself some mercy and some love and kindness as a counselor, as a therapist, whatever your field here is, nurses, whoever I have in the room, and being able to understand by me practicing mindfulness, I'm being present right here, right now, not just with my client, but with myself. And then I practice a powerful level of acceptance of what I can and what I cannot do. Sandra says, I disassociate when someone starts stating politicians' names or anything political, really. Yeah. But as a realist, it's here. And we have to truly, truly practice a lot of love right now, not just with your clients, but ourselves. So what are the symptoms of political and election-related stress? We talked about the heart rate, inability to turn off. We also talked about, no, we didn't. Here we go. Frequent stomach aches or headaches, increased substance use. I saw that a lot during COVID. A lot of substance use and abuse, anger and irritation, chronic pain. So let's say I am a client and I come into your office, okay? And I am right now, I want to just talk about the intrusive thoughts, okay? Oh, did I click on? The intrusive thoughts. And I'm also going to be talking to you about my anxiety and worrying due to my benefits. And if somebody can, I don't, volunteer, I would love to role play a little bit. So are you seeing clients that are struggling with our current political climate? Are you teaching here? This is the piece here I want us to really hone in on. Are you teaching or recommending more self-care practices? As a therapist, are you implementing self-care after each client you see in a day? So this is for you. How many practitioners are incorporating more trainings on resetting the central nervous system? Do I have any EMDR people on here? Certified practitioners, EMDR? I'm a Reiki practitioner and vibrational sound therapy practitioner. And I've been doing more of the body work than I've been doing now in the counseling sessions. Because you got to keep in mind is that what I'm trying to educate and teach my clients about is how to cut off the world, how to cut off. And what I mean by that is, first of all, I'm a gardener. So I'm able to actually be outside, be in dirt, touch the dirt. A lot of times I don't have any shoes on. So I'm able to go into a safe place. I'm able to go away. So what does that conversation look like if I was to come to your office right now? And if I was saying to you, I cannot turn off the TV. I cannot. Anyone? All these cameras are off. Anybody? Just not the chat.
No, I'm really conflicted on that turning off the TV thing because I think it's important. I think it's tricky because I think of course we all need to be unplugging right now and taking in media and outside conditions as we can too. But I think we also need to be very aware that there's a tremendous level of privilege and being like, I'm just not going to pay attention to this. Because whether I ignore politics, politics isn't going to ignore me. And it's certainly not going to ignore the people that I serve that have far less privilege than I do. And so I think there is some responsibility to maintain a connection to like the world around us right now. And I think that's when somewhere where I'm really struggling right now, because my ear kind of gets a little bent when I hear, well, I'm just not paying attention to that. And it's like, then someone you serve is gonna feel the sharp end of a stick and you're not gonna know why. And so, yeah, I don't know that I have the answer to that, but it's something that I'm definitely struggling with right now. And I love that Erica just mentioned that window of tolerance. I think that is kind of that piece right now of like figuring out like what's in your window of tolerance. So you can move forward.
Can I pick on you, Erica? Talk a little bit more about that because that intrigued me.
Sure.
Yeah.
What would you like me to say?
Go a little bit more in deeper if you don't mind. I was reading your chat. I talk about the window of tolerance for those who may not be able to practice that or even not even know what it is.
Sure. The window of tolerance is a concept that was developed by Dan Siegel, who was a psychiatry professor at, I think, UCLA. And the idea is that our window of tolerance is the optimal zone for our emotional health awareness and like where we can handle the slings and arrows of outrageous fortune, you know, to quote Shakespeare. Sorry, God, that was so pretentious. um, and um, and basically when we have sometimes we experience stimulation that sends us either into hyper arousal or hypo arousal, or sorry, dysregulation, and then into hyper or hypo arousal, and that sends us into the stress responses of fight, flight, freeze, and fawn, and can cause trauma. So the idea is to spend as much time as possible in our window of tolerance so that we can handle stuff without becoming dysregulated and to do things that widen our window rather than shrink it. Trauma shrinks it, being hungry shrinks it. You know, there are a lot of things that can shrink the window, and there are a lot of things that can widen it, although of course it's harder to widen than it
Yeah.
is to shrink.
Yes, it is.
Yeah, and there's a great book called Widening the Window by, I think, Elizabeth Stanley, who talks about the window of tolerance a lot. And it's a great resource for people to understand um, their activation and to get in touch with, I'm feeling a little bit activated right now. What can I do? Like, what kind of grounding exercises do I need to drink some water, etc., to take care of my window?
Thank you. Thank you.
Sure.
Appreciate
Thank you.
that. Pamela, yeah, what if this is what has caused your trauma? And just even having that discussion, I'm looking at some of the chat right now, of looking at the discussion of even just educating. So, Erica, every time you watch the news, tell me what goes on with your body, okay? I'm just not talking about, the things that, what I'm hearing or what these people are doing, and I'm getting so focused that I'm hating them. But how can you talk to me about when you just saw that, did it cause you to have a craving? And if so, if I wasn't looking or watching that right now versus if I was outside, because, I'm a big believer of asking clients, do you have any hobbies? I really am. And so what if you were, okay, I needed to change the oil, in my car, or either my mom wanted me to take her shopping and pick up a couple of things. So some of the what ifs of me getting away, finding ways to get them away from the TV, but not only that, finding ways to talk to him about, are you holding your breath when you're watching the news? Okay. Have you noticed the difference of, let's say you don't watch the news for 2 days. How was your sleep that night? Or having somebody help you if you live with somebody else. Are you able to put it on a timer or to get an update from a family member or a friend? But it is me trying to get you away from the TV. Okay. So let's talk about coping. When trauma is not dealt with in a meaningful, direct, and compassionate way, it is left to fester, grow, and inevitably lead to more profound levels of traumatic injury. So signs, feeling overwhelmed regarding current events, emotional. And right now, and I used to talk this a lot when I was presenting during COVID, because the world, we were all online. The stages of grief. If I was to ask you right now, what stage are you in? Would you be real with yourself and admit to where you are? Or are you in all of them? Because I think I flow. I'm kind of like a flower in the wind. I ebb and flow when it comes to grief. Yes, I am still in shock. I'm not going to lie. I am in shock and I am angry, but I do not allow the anger to overcome or succumb me. I admit that I am angry. I also admit what I can and I cannot do to suppress my anger to the point of making sure my blood pressure is okay. So just having this conversation and of a mentors with your clients and yourself. Am I depressed? Or have I just accepted that the world is ran by Circus Soleil, like by a whole group of clowns? Have I admitted that? So I can have some peace. And if so, how will I still care for me and my family? Do I create bonds with other people, other family members? Because I know returning back down south, I get to talk to a lot of gardeners. I get to do bargaining with food. Somebody may have eggs, I may have squash and okra. So my mindset is in a totally different place to keep me safe. Are you having that conversation with your clients? Okay. Because we are learning on an invisible alley called normalcy bias. The normalcy bias feeds our appetite to feel safe, in control, and able to predict what's waiting around the corner. So as a practitioner, how can we get into the habit of implementing PTSD scale versus anxiety and depression? Or our clients in fight stage when we're living in a hyper-sensationalized society? Are your clients dissociating to zone out because they can't cope, staying high all the time, staying intoxicated all the time? Just taking a pause here.
Javelin, there are a couple of comments.
Okay, go ahead.
This was on your last slide. Madeline said, this is where I talk about looking for both ands versus either ors, so that it's not either the TV is on or off and becomes explorations of what, how, when, why we engage with consumption of news, media, etc. This is also where I work to encourage and teach people information literacy, conscious consumption, critical consciousness, etc.
Yes, thank you.
And Grace said, to answer question one, as a SUD counselor, I have a client saying every week that he doesn't get the point of stopping his drinking and drug use, as he feels that with the current political climate, we are on the brink of World War III, and his substance use will be the least of his worries. And then Alexis says, hierarchy of needs gets brought up for me too. It would be hard to stay informed or not feel like the straw that broke the camel's back if you are worried about food, water, shelter, basic needs. Doom
Yeah.
scrolling is also a reality for many folks. So setting boundaries to not feel like they are drinking from a fire hose all day long is a good conversation. These boundaries may look different for everyone.
Yes, they may. Yes, thank you. Thank you. And and the question, for the substance use dependent counselor, if I'm from down south, so these I'm gonna make a judgmental comment. My people down here, they drink like it's a religion, okay? And in the midst of being intoxicated, how would he be prepared? How would you be able to protect yourself if you were under the influence? Have you already got those things in order? I just like having conversations
79.
with people.
Is it you? I need to get.
Huh?
I need to get the title updated.
I didn't
I think you
catch
had a
that.
person that had their camera was on mute, was not on
Oh,
mute
okay.
when they should have.
Okay.
Yeah.
Okay. Thank you. And just having that conversation, so hypothetically, if it does, are you ready for that? Have you stocked your food? You may have enough beer, but have you stocked your food? Have you stocked your water? I like to have those type of questions with folks, because if they gonna drink, they gonna drink. But I just also want to know, besides drinking, are you prepared? Go ahead, Sheila. Oh, I'm sorry. I thought somebody was trying to say something.
Well, yeah, you're fine. I think what I'm hearing there and what I've been kind of really doing with folks that I'm working with is really talking about that like sphere of influence. 'Cause I think folks are spending a lot of time right now, like, well, what if my Medicaid gets shut off a year from now? Like, what I'm kind of just here laying on the ground. Because that's what we can control right now. And this is something else I've been thinking about a lot. So we live in a state here in Idaho that, is we are a super majority party state for one party, and so the people that we talk about aren't these bogeymen that we don't know about. They're our neighbors, and they're our friends, and they're our family. And so I think this kind of like, I think it's so tricky right now of kind of like this like othering of like, well, the world's gone crazy. Well, your neighbor probably voted for this crazy world they're talking about right now, or maybe your mom did, or maybe you did. And now there's a lot of like, oh, now what? And so I don't know that I have the answer there, but it's something that I've been kind of like thinking about, like, well, the world's gone crazy. It's like, no, these are people, this is your neighborhood. And what can we do within our neighborhood to actually make change rather than just kind of scream at the sky? Not that I'm not doing plenty of screaming at the sky right now, but it's something it's been kind of been on my mind lately.
Thank you. It's also good to be collaborating with not like-minded people of, well, I have a passport, if push comes to shove, and I know somebody's going to run out of medication, is there somewhere else we can travel to get it? That's just a conversation. I'm for real. I'm for real. That's a, are you in, what did I ask a group of people the other day? I asked them, were you in trauma mind or survivor mind? Because if I'm in trauma mind, my survival skills can't kick in. And then my little old country self, I grew up on beans, rice, and cornbread. I can grow beans outside too. And it's almost as if you're having to outsmart the corruption. Does that make sense? Or am I just talking to myself? I'm serious. A level of awareness of, I know this is happening, but I also know I've survived off of beans, rice, and cornbread. And my ancestors survived off of X, Y, and Z. I know how to fish and I know how to hunt. So what are y'all survival skills looking like? I just want to propose that question to you all right now, and a general conversation with your clients as well. So strategies to treat political trauma, centering yourself at the start of the day. not turning that TV or that phone on right away, not trying to look at current events right away, limiting yourself on social media. As a yoga instructor, I advise my students to choose 3 poses. And this is me too, because you can do these in the bed. You can do child's pose in the bed, downward dog, cat and cow. All I'm trying to do when I wake up in the morning is center my central nervous system. I'm also trying to get a reset. What practices and modalities are you implementing for yourself, but for your clients as well? But most important, you. What are y'all doing? What do you do? How are you keeping your central nervous system? Breath work. Yes. Yes.
Javelin, can I make a point or
Please,
observation?
please, please.
Um, I think it's so important to take care of our nervous systems and to regulate. And I also think that it's very important that we not shrink in support of our nervous system. Like, I'm not going to engage with the world or call my representatives or whatever because my nervous system is too fragile. Because then we run the risk of checking out and becoming complicit in a regime that causes us moral injury in perpetuating and harms our clients and harms
Yeah,
us too.
yeah.
Obviously, I can't speak for everybody, you know. I mean, I'm progressive. I will, you know, proudly own that. And this is horrifying what's going on in the world. So, one of the things that I have to do is be an activist and help my clients who want to widen their window
Yeah.
to advocate for the world that they desire as well.
Thank you so much. Grounding, putting my feet in moving water. Yes. Don't over intellectualize or ruminate. Deep breathing, sign of the cross, and mediation and going to Zen events. Somatic regulation. Yes, I love that. Breathing, tapping. I think I'm the tapping queen. Humming and grounding exercise. Okay, let's get to this humming. JC, I don't know if you know, but I've been reading some research lately, and humming resets your central nervous system. And
Yes.
maybe they put that because they know that, but I just found that out.
Yeah, I actually quite a while ago I seen this really cool thing about how like the bees, you know, the frequency and the humming in the bees is does a similar thing, and so I started incorporating, yeah, humming, and I love it. Yeah.
Yes, thank you. And it does taps into the vagus nerve. Thank you, Madeline. Yes. So if you don't know anything about any of those modalities that was just shared, that's some homework for you. You know, you could start practicing them yourself because I love showing my clients about the tapping and just being able to touch and not only that, I'm able to acknowledge, you know, on a scale of 0 to 10, how intense is this for me? You know, how is it affecting me? And anything I do a mind, body, spirit approach. Every question I ask my question, how often are you thinking about it? Where are you feeling it? And is it causing you to be kind of like in an unstable float? That's that spirit. Okay. 5, 4, 3, 2, 1. What's that say? Hugging oneself, things that raise your oxytocin. Yes. Cool shower. And I love ACT, you know, because accept reality. I went too fast. And comment to taking care of your mental health, the ACT model, acceptance and commitment therapy is a big model that I love, because just having those conversations about what I can and what I cannot accept. Okay. Question for your assessments. And I know some of this may be basic for you all, but we also have some folks that may be new in the field. Do you include health questions in your assessment? Biosocial assessment, or are you ruling out medical versus behavioral health symptoms? This may sound like a basic question, but are you able to identify the health issues caused by your client's trauma? For example, fibromyalgia and autoimmune diseases. I like the NAP ministry too, NAP Melon. And I also have the rest deck here. It's kind of blurred on here, but I'll try to move it all the way out, but it's blurred. Unfortunately, I have the NAP ministry rest deck on my desk. Can I get 2 to 3 people to chime in about some of the medical stuff? Are you ruling out medical versus, if I stop getting off the slide, are you ruling out medical versus behavioral health symptoms? Are you able to identify the health issues caused by your client's trauma? If you're not familiar with a lot of autoimmune diseases, that'll be something great that I really want to encourage you to look into. Several of my female clients who also have significant trauma histories, oh, it popped up, sorry, also have autoimmune disease symptoms. Besides medication, Aaron, if you don't mind me picking on you, how are they treating it? How is it being treated?
They are going to functional medicine doctors or physical therapy, hormone therapies, because when they go to their PCPs and they're getting different tests run, blood tests and things like that, those traditional tests come back like, well, you're in the average normal range of whatever, and they feel like they're not being listened to. And so they go to somebody else who's less traditional, like a functional medicine doc. And that's where they are feeling heard. They might try some, like something herbal or just less traditional, not non-Western medicine. And so if that's what's making, them feel better, then, great. And so that's something that we always talk about is with trauma-informed care is that, you referenced the body keeps the score. And so I talk about that with them. If, you've buried this and you've lived with this for a long time and it will come out one way or the other. And typically your body is going to tell you that we need to talk about this. We need to deal with it. And this is what's happening. So
Thank you. Thank you for
Uh-huh.
let me
Sure.
pick on you too. And Madeline, I'm gonna come to you too. I want to pick on you. You said yes. If as clients are comfortable and able to access medical care, I recommend getting them through blood work in addition to counseling and any other services. I can't tell you how many people, this is big, you guys, because this is me. I cannot tell you how many people present with symptoms of depression and also have vitamin D deficiency. I first got tested almost 20 some years ago. And I just was so fatigued. My sons were young. I thought they were wearing me out, but no. Melon, do you want to respond or go into what made you start, asking your questions about this or getting this tested?
Sure. My internet doesn't work right, so I'm not going to be on camera, but
That's okay.
a few years ago, I had gained a bunch of weight out of the blue, despite not having a car and biking everywhere, and had a doctor tell me that it was purely my diet and exercise that was to blame, which is not an uncommon story that we hear, especially in female presenting folks accessing traditional Western medical care. And things got worse and worse, and I felt like a husk of a human, and I was on blood pressure medication at like 22, 23 years old. had the privilege of being able to access a functional medicine clinic where they did thorough workups, and it turned out that what had happened was my digestion had completely shut down. So no matter what we were putting in my body, I wasn't able to absorb anything. And through that experience, I learned a lot of these kinds of questions to ask in any sort of treatment setting, as well as recommendations to, if a doctor or another provider is not doing something, to have them document that. If you've asked about something and they say no, to document that, because there's a lot of stuff in the ways in which doctors or other providers do their documentation that covers them, but leaves patients or clients in the lurch, so to speak. So I tell people to take as much of an empowered stance as possible, and I offer to role play these kinds of questions and settings with clients and my own work with them, because the biggest takeaway that I got from that is that the healthcare system tries to treat health and or wellness as one size fits all, but benefits very much from illness. And so being an active participant, informed about your own body and health experience can make a huge difference.
Thank you. Thank you so much. Yes. JC says, I have a medical background. Because of that, I have the approach of making sure clients aren't suffering from medical and medication issues that can be contributing to mental health. Like to encourage, Teresa says, I like to encourage children to learn how to listen to their body and build awareness early. Thank you. I talk to my clients. This is all what I have, you guys. I call it my my little 4-pie self-care model. I have an acupuncturist, I have an herbalist, I have a chiropractor, and I have a massage therapist. And I also still see my own Reiki master person for my care and treatment, as well as the sound bowl therapy. The sound bowl therapy, if you have never had vibrational sound therapy or Reiki, the amount of energy that vibrates from those bowls, you will just be totally mesmerized, okay? And I don't know if you can be able to see them on the screen here, but there are various sizes, okay? And we play the bowls on the same meridian areas that you do with your acupuncturist and your reflexologist. And the thing about the bowls and your 7 chakras is that if something is plugged up or either backed up or doesn't work anymore due to the level of trauma, the bowl will tell you. The bowl will let you know. So when I am doing a session with somebody and able to hear when something strikes, and if it doesn't chime or give me that level of energy of the bowl that I want, it lets me to go a little bit more deeper into those places. So if you yourself, I don't know if you're going to be able to hear this, but if you yourself have never had any type of Reiki, energy work, research it, look it up. Even with some of the clients, when I had found out that I had fibromyalgia, I was told that it was going to hurt if I did acupuncture, and it did not. So I was so happy that I researched myself. Acupuncture is outstanding for perimenopause. It's also outstanding for postpartum. I've referred a lot of women who unfortunately have lost their children or either have had children with hard births or either C-sections, and that helped them as well with the level of trauma that they experience on their body. Acupuncture, massage, chiropractor, counselor, energy release, yoga, dancing, nature. I had a nutritionist and naturopathic in the past as well, and I used to get salt floats. Oh yeah, I forgot about the floats. Thank you. Thank you for adding that to the list. So we talked about ACT. So embrace the history you're trying to change in this current situation. What part of change, and these are just questions, can you be a part of? Turn off the news, turn toward fresh funnels of interest and learning. What new self-care practice can you incorporate in your life? And here it is, we're talking about it now, the exercise, yoga, acupuncture, massage therapy, Reiki, calming. Okay, so before we go into this, I would like to do a body scan with you, especially since we have reviewed quite a bit, you know. If you're feeling safe, if you're in a place where you can either have your back against something, or you at a place where you can just softly close your eyes or have a soft gaze and tune into my voice if you can. Just listen to my voice. I am enough now. And just breathe that in. And slowly release that. Relaxing your forehead. Making sure the muscles in your face are relaxed. Especially your jawbone. Just making sure that's relaxed. And just notice your tongue. Where is it? Is it flat in your mouth? Or is it sticking up to the roof of your mouth? And in this practice, we will also look into ourselves just to make sure that we are here and that we are present. And incorporating a prayer of gratitude, just being able to allow yourself to be here, to learn, to release, letting go, and accepting the things that are out of your control. Also accepting the things that no longer serve you. Having heavy shoulders, heavy arms, heavy hands. Noticing the rise and fall of your chest. And take another inhale. Allow that inhale to come all the way to the top of your head and just hold that right now. And allow a long exhale to go all the way through your body to the bottom of your feet. And just imagine a very, very bright light, very loud, bright, indigo, ocean blue, sky blue, the warmth of the water in Jamaica or Maui or Hawaii, any tropical place that you have been. And just allow your feet to touch that sand. Allow yourself to just throw the water all over your body until you totally saturate your entire body in the water. If you're not a swimmer, you could just sit in the sand and allow the waves to come up and down your legs, your waist, and just being glad with yourself that you had enough in you to be fierce enough to experience being in that warm water. Bring that breath up and down your spine, your vertebrae, around your waist, down your pelvic, down your legs, top of your thighs, around your knees, the back of your knees, down your calves, up your shins, and allow that light to go all the way through to the bottom of your feet. Breathe in once again. I am enough now. Hold that breath and exhale it. Inhale, I am enough today. Inhale that deep, hold it, and exhale it out. And breathe in again. I am enough tomorrow. Thank you. Thank you for participating in that body scan. Hope I didn't put you to sleep. Get you to come back. Get you to come back. Wiggle your toes, wiggle your fingers. If you're up, take a stretch. If you're sitting, still take a stretch and allow your arms to be up. Do like a morning stretch. Thank you. Let's get into environmental factors. We're coming almost to an end here. And I hope you guys are getting what you need today. Environmental factors. I am in the state of Louisiana. It was not until I retired and came back home. One day I was watching a PBS special and they called my state Cancer Alley. I did not know that my state was called Cancer Alley. CANCER is what I'm saying. Cancer Alley is from New Orleans through Baton Rouge, through all types of small states. And I got a chance to be a medical social worker when I was at LSU, when I originally came back in 2021. And I was in total shock of the amount of clients that were coming to the hospital, LSU here, asking questions about the level of cancer. But not only that, the areas that they lived in, where there used to be chemical plants. So now here it is, not that they were only dealing with cancer, but the hypervigilance of, is it in the water? Is it in the food? Are they growing it in areas where there's cancer? So here it is, you know, you're already dealing with a cancer diagnosis, but you also are having to deal with all the thoughts that causing them to have anxiety, causing them to be worried a lot. So what environmental factors are you incorporating in your assessment that can appear to be a mental health disorder? Have you inquired if your client has severe allergies? Need an allergy test? Reside in a high crime area? Rides the city bus in an unsafe area? Because we're getting ready to go into the hyper-sensational definitions. Lives in environments that has toxic chemical waste. High houseless and drug environment. Keep in mind that causes hyper-sensational as well. Reactivity, allostatic overload. Where I live, it affects me. So the difference between hyper-sensational and hyper-sensational and sensory overload. What is emotional hypersensitivity? A system that involves extreme sensitivity in your sense of touch. Sensations that should feel light or easy to tolerate feel intense or even overwhelming. It often happens along with neuropathic pain. I've seen this in a lot of my clients that have diabetes. Hypersensual or hyperthesia refers to heightened sensitivity to sensory stimuli. Now, this is what I'm seeing in adults with Asperger's and on the autism spectrum. I've also been reading a lot of research because this was brought up to me by a nurse that I've been having a conversation with. I had a client, unfortunately, that lost her baby because her diabetes shot up during the pregnancy. And I also have had some mothers who had diabetes when they were pregnant and their child ended up being on the autism spectrum. So I can't wait to see some more research on that. Leading to discomfort or pain where normal sensations are perceived as intense. Symptoms include heightened reactions to touch, sound, light, taste, or smell, and can affect any of the senses. Hypersensitivity has been linked to other disorders which are known to cause these conditions, such as autism, sensory integration disorder, Down syndrome, OCD, ADHD, episode of nervousness, anxiety, fear, elevated stress, medical related triggers to hypersensitivity reactions, airborne allergens. That's what I was talking about, those allergy tests, such as pollen, animal dandruff, dust mites, and mold. All this was new to me. So I had a client tell me they had all these tests. I found these symptoms common in a lot of African-American clients, especially Southern clients and rainy climates such as Oregon and Washington. I also experienced, especially in the African-American community, the amount of asthma, from trauma, environmental factors, old homes, and other disorders that come along with that. So what is emotional hypersensitivity? It is described as a lack of emotional resilience tied to low self-esteem. Hypersensitive individuals are unable to manage their emotions, and they often feel attacked. They have a delicate feelings and usually haven't developed coping skills for dealing with those feelings. When triggered, they're likely to react in unhealthy and often extreme ways. We would probably call that person bipolar, but it may not be. Be aware, these are explosive behaviors, yelling, throwing things, breaking down, weeping, inappropriate reactions, similar to old school explosive disorder, explosive behaviors. Insecurity and low self-esteem to be an issue for hypersensitive people. Highly sensitive person, HSP, is a biological predisposition that occurs in around 20% of the population. HSP are more aware of subtleties in their environment because the way their brain processes and reflects on information more deeply. Activations of the brain and of regions with empathy awareness and other processing. So that was a lot there before I move on a little bit. Comments, questions on some of these areas, especially with the Down syndrome, OCD, ADHD, the hypersensitivity, and autism. Has anybody else been reading research related to diabetes with mothers and fathers that have children? You guys still there? Hope I ain't put everybody to sleep. Comments, questions? Anybody working with children on the autism spectrum or adults? Yes, I have not, but I'm intrigued by this. Yeah, it's a lot of research going on. I follow a couple of therapists on Instagram, and that's who brought up the conversation. So I'm trying to keep an eye on when they're getting ready to have a presentation about it. I'm also trained in you're going to explain what that is. I have no idea what that is. Madeline Jewell. Can you explain what that is?
Yes, I realized I could stop typing. It's the Montero interview guidelines for diagnosing autism spectrum, the second edition, and it's a qualitative assessment process that's more based in the sensory experience rather than some of the like more quantitative measurements that exist out there. It also complements I don't remember what this one stands for, but the ADOS assessment pretty well.
Okay, thank you. Thank you. And thank you for being vulnerable, Ian. My family has a history of diabetes and cancer and autism, anxiety, and depression. And I am the spectrum and have schizoaffective disorder. Thank you. Thank you for being bold and vulnerable. And just to go a little bit more deeper into that, Ian, and I hope I'm pronouncing your name right, is when I started seeing it also at LSU for a lot of the parents that will come in that had diabetes, their children did have that as well. Others. And did I get a show of hands of folks that work with that clientele? Okay. Let's keep on going. We got 2 more slides. So need to calm your sensitive nervous system. That's how I be looking sometime when I go into the store and I see those prices in the grocery store and you're trying to count your money and shop at the same time. So ways to regulate, and I think we talked about some of this. Belly breathing, screen breaks, mindfulness, affirmations, seeing the disorder as a strength. You know, just even having that conversation with somebody. How is bipolar, schizophrenia, PTSD a strength? You know, what is it that you know you may need to do different? And something that I realized I didn't add on here, but foods are big. You know, I talked about the environmental piece, but also just having conversations with your clients about what they're eating, you know, especially the processed sugars and the MSG, what is it? MSG foods, tapping, AKA emotional freedom techniques. We talked about singing and humming, grounding, walking in cool water, nature, hugs, animals, bugs. Okay. So this is to us now as we get ready to wrap up here. Somebody put I'm close to being certified for dual diagnosis population. Good. I have a low sugar, gluten, lactose, and I don't know what that is. Eat something. Oh, is that how you pronounce it? Pescatarian, except for chicken. And did I get that right?
Yeah, the fish eater.
Okay.
Yeah.
She's a fish eater. Thank you. I wonder, is that what I'm coming? Because that's pretty much all I like to my stomach can tolerate lately. So creating a resilient culture for healing, you know, draw your own support system. Who are you guys connected with? That's a question I always like to ask folks as a counselor, as a therapist, or whatever health field that you in. Who are you with to support you with what you're going through, or the type of clients that you're seeing yourself? Do you process your grief and loss? If so, who are you processing it with? Use this time to reevaluate your values, relationships, and goals. Staying in the moment. Join community events that have a safe space to discuss how you're feeling. That's very important. Join NASW or any organization in your practice that implements change by creating new policies and procedures in the health systems. And anything else on this list that you don't see that would be a great idea, please share it. Summary, reflections, takeaways.
Is it okay if we speak for this, or would you like it in chat?
I would love for you to speak. I'm so old school. I am. I'm just gonna be honest. I'm so old school.
I really appreciated when you started talking about complementary medicine and energy work and those kinds of practices. I was introduced to them after a number of significant traumas. And when you talked about body keeps the score, and that was the first time I was introduced to methods that could create enough spaciousness where it felt safe enough to acknowledge I had a body and then enter that space. And then when things started working, I started facilitating those. I know that some of the challenges can be affordability, especially for the people we serve, or it's not covered by insurance. And I appreciate that you shared some that could be, or some that are accessible for free through apps like EFT tapping, as well as other ones that maybe require more financial means to access.
Yeah, thank you. Thank you so
Thank
much.
you.
I had the trainers of, and I'm trying to look them up right quick, trying to multitask here. The trainers of the vibrational VBS, vibrational sound therapy, and I'm trying to think of the state that they're originally in, but their state got behind them. They're able to bill for their services for vibrational sound bowl. I am so jealous. They're able to bill because they see that as a form of therapy. So hopefully one day, just like acupuncture and reflexology, people are able to bill. One day somebody's going to give us permission to bill for Reiki. That's just my hope and my dream. Summarization, last minute questions, thoughts, comments.
So there are a couple of things in the chat.
Okay.
Thank you from Madeline. Thank you for the time, care, effort, engagement, and everything put into this presentation. This has been a deeply appreciated space to sit in today. It's from Josie. It's just nice to hear all the other ways folks practice self-care, whether it's therapeutic or other practice. And then thank yous. It's awesome. Great to attend.
Appreciate you guys.
You got a couple minutes left if anybody else wants to share.
And any questions for me? Something that you may didn't get answered or something that I didn't see in the chat? But I really want to encourage folks, especially environmental wise, start asking your clients what they live around or either what's in their environment, and the tests, especially the allergy stuff and the diabetic stuff. That's huge now. But I appreciate everybody that came today. I think I saw the survey in the chat too.
I did put it in there, and I'm going to put the slides back in there for anybody. I realized that the slides that I had up on the website were an earlier version, and I've taken those out, and it's the same link. If you downloaded the slides, go ahead and refresh your history on your browser and re-download them, and you'll get the current version of the slides. Well, thank you, Javelin. What a wonderful presentation. Obviously, we've had some great interaction, and there are wonderful things continuing to be put in the chat. I will send an email in the next hour with the survey link and the links from the session, and a reminder that you've got 2 business days, so Monday at 1:30 to complete your survey. That's one of the requirements for CEU eligibility. And you can redo as many times as you want, as long as the survey is still open. And if you have any direct questions, I think one of my colleagues will put the Empower Idaho email in the chat. The slides and recording will be available on the website in a couple days. And we thank you all for coming and being such a great audience and presenter. Thank you, everyone.
Thank you, guys. Don't forget to play. Get you some bubbles, jump rope, chalk. Don't forget to play.
hum, tap.
Yeah. I'm gonna be the
Thanks.
last one to log out. Thanks, you guys.
Have a great day.